views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Coming up, when it comes to maternal mortality, New York State ranks 30th lowest in the nation. Additionally, on a national front, research shows that Black women are almost 4 times more likely to die in childbirth than white women. And according to the New York Times, 12 times more likely in New York. Today, we'll sit down with a panel of health and healthcare professionals to break down why this is happening, what you should know about childbirth and your body, as well as take a look at a new task force by Governor Andrew Cuomo with a goal to reduce these numbers. I'm Veronica Guiti, welcoming you to this special edition of Open. Welcome to this special health edition of Open, where we will get an in-depth look at maternal and infant mortality and a number of health issues women face when it comes to childbirth. Joining us now and in studio to break down the issues of maternal mortality and educating women in the Bronx as well is a doula program we have, Rosie Hernandez, health educator at the Bronx Health Link, Glennis Thomas Perales from Bronx Care Health System, formerly known as Bronx Lebanon Hospital, and Alma Idahan, Program Manager for the Bronx Healthy Start Partnership. Welcome. I'm just so happy to have you all here. We got to chat before we came on set, and we're all mothers here. So I know this is a very important topic of conversation for us, something that we've probably all been waiting for the state a long time to take a look at this and say, why is this happening? Yeah. So I just want to begin by reading a quote that was in the press release that Governor Cuomo delivered. He said, "Maternal mortality should not be a fear anyone in New York should have to face in the 21st century." Right. Governor, that's a quote from Governor Cuomo. He said, "We are taking aggressive action to break down barriers that prevent women from getting the prenatal care and information they need. This comprehensive initiative will work to correct unacceptable racial disparities in maternal mortality and help to ensure a healthier and stronger New York for all." And I know that this is something that you all, in your own respect, are working towards. So at first, I just want to delve into this and tell me, what were your reactions when you saw that this came out, that this task force had been created? I know you want to begin.
No, it's exciting, and we're quite happy that the governor has moved forward with this. I'm also part of a coalition, New York City Coalition for Doula Access, and we've actually been working towards a payment structure for doulas across the city, and have actually sent a letter to the governor's office back in 2011 to say this is a valid, very important service. And of course, again, people of color are not able to access these services. And so having Medicaid reimbursement as the means of paying for the service would be something that could sort of level the playing field to a certain extent. And it didn't gain traction then. So we're excited that it has gained traction. However, we have some concerns about the structure of it.
I know some of your concerns were the actual people who are on the task force.
Right.
Why do you have concerns about that?
So this is a community-based, and it should be a community-based strategy. And what we know presently from what was said, and when we look at the individuals that have been identified as the task force to develop a pilot project in 45 days, clearly there is going to be some limits to that and some exclusions to that. And right now what we know, and although these are really great community folks that are on the task force, we find that there's no one with lived experience, no advocates that are part of that conversation at that table to be able to make sure that we're looking at what are the key things that needs to happen. And we're also concerned because there weren't specific strategies that will target some of the social determinants to then be able to make sure that we're doing a more comprehensive type of approach. We can't fix everything with just one effort. However, we would like to see advocates and community folks at the table to be able to then make sure that the piece that we'll do will certainly be able to give us the kinds of information that we need to be able to really change the data in New York State and New York City, which is, I think, the governor's interest.
Now, Rosie, you're an experienced doula, so talk about the importance of being part of this conversation.
Data shows that women fare much better in their labor and their births with support. It's one thing to feel that you're alone and you have no one there, but when someone is with you, whether you decide to have a natural birth or a medically managed birth, you're not alone. That confirms to you that you can birth your baby the way you desire to birth your baby, but when you're alone, that's where desperation and hopelessness falls in. And so doulas kind of step in and be the support for the mother, for the partner, for the family.
I think a lot of women, because I know when I was pregnant twice, I always was interested in a doula, but I never thought that, I thought it was something that only like rich people could have, right? I never thought that I could have a doula. Yeah. And so my support system, luckily my husband was there, my mother was there, but a lot of women don't have that, you know? And so to be able to say, you know what, you can have someone in the room with you, you don't have to do this by yourself. Why aren't a lot of women educated on this? I mean, the resources are there. You all are here to show that the resources are there. But why do you think maybe many women aren't taking part in having a doula?
I think it's a lack of education and a lack of promotion. A lot of the times we have services, and the services stay in one place and don't spread out. So if we'd have more education, like program like this, and letting know the whole Bronx, listen, you have these programs in here, you have doulas in here that can serve you, that can be there with you. At that moment, you will be, oh my God, I didn't know about this. I'm pretty sure that people, a lot of women that will see the show today will say, wow, doulas in the Bronx? Where? I didn't know this.
Absolutely. I had no idea of that.
So I think that's what it is. It's the education and promoting, the promotion of the programs that we do have here.
Now, let's take it back and just go into the responsibilities of a doula. Like, why is it important to say, or to have this as a consideration for those who may not have the knowledge of what a doula does?
Well, specifically, the woman is birthing. Birth is a very normal, natural, biological process. And a lot of times, I mean, when I had my children, I had my preconceived ideas. I wanted to deliver like grandma did at home, right? But I wasn't able to afford that financially. And I knew I could go to a hospital. But I also knew I'm not sick. So is birth, a lot of times, when you're in a hospital, it's managed as if there's something wrong or someone has to step in and kind of do for the woman what she can do for herself. And so a doula pretty much kind of speaks to the woman and says, well, what are your goals for your birth? Now, clearly, women, there is health risks, because if the mom comes in with some chronic illnesses, or kind of labor and birth kind of is like a bridge, you don't know what's going to happen. There's turns of events. But when you have someone there that can guard space for you when you're the most vulnerable, and you've had these conversations with your doula to kind of, the doula doesn't speak for you, but she can make sure that the connection is being made between you and your care provider, and kind of say, hey, remember, you said that you preferred a delayed cord clamping. Remember, you said that you wanted the ointment or the injection to be given maybe while you're holding your baby skin to skin.
Right.
Oh, okay, so you've had to have a C-section. You can still have your baby skin to skin and begin initiating the breastfeeding process. Most women don't know that. A doula comes in and kind of lets the mom know the most important thing for your baby is still you, the mother.
And I just want to point out that doulas are certified. It's not just volunteers, someone that says, you know what, I have many kids, I think I can do. No, you're certified to do what you do.
Right. Doulas go through training, and they also, depending on the organization that they choose to train them, there is a protocol, there's prerequisites, and your certification. Doulas are experienced in the process of birth, the process of initiating breastfeeding. They're also aware of what a medical birth looks like, and they encourage the woman, right? They're not taking charge of anything. They're not a medical professional, but they're giving moral support, informational support, comfort measures. We find a lot of times when you have, let's say, an IV that possibly you don't need, but say, hey, maybe just a hep block, and I'll take my IV fluids intermittently. Is that possible?
Right.
Have the conversation.
Now, going back to having the conversation, I want to go back to where we were talking about maternal mortality. When a woman steps into the room and she's getting ready to give birth, your hope, of course, is that everything is going to go well, right? That we know this process is coming. It's going to be hours of pain, but then next a lifetime of happiness, right? So that's what we're hoping for. But when you go into that room and there are a turn of events and you give birth, I think once you give birth, many women are not aware that a lot of things can happen postpartum.
Right.
What are we looking for? And also, I think when women feel something, like how do you make sure to tell your doctor, even if your doctor is telling you you're okay? Because we saw this with Serena Williams, right, and a couple of women. If your doctor's telling you that you're okay to go home, but you're not feeling well, how do you make sure that you're advocating for yourself?
I feel that we should educate the patients that we work with, right? Letting them know if you feel something, it is your body. You know your body better than anyone else, right? So the doctor can say, no, this is something natural, this is something, but you're feeling that, no, this is not natural. I'm feeling something that it was not there before, right? It's educating them and say, no, you have the right to tell the doctor, I am not leaving this hospital because I have the right to get the medical attention. I have the right to be seen and to be observed for a certain amount of hours to see how it develops. I am not feeling well. I want to stay here. And you have that right. And a lot of the times, our moms are not educated in this aspect. And they think, well, the doctor said that I have to go home. I cannot stay here. Right.
Why do you think that this is happening so much with women of color? Is it that our word is not being taken as credible? Okay, yes, you're a doctor, you have the degrees, you say that you see on my chart that everything is going well, but I'm saying that I don't feel well. Why are so many women being sent home, and then dying maybe weeks later, 2 to 3 weeks later? Why do you think this number is so high?
I know we're not clinicians, but just looking at the reports and looking at the data that exists around, these adverse outcomes, there are things that individually, whether it's implicit bias or structural racism that exists within our organizations, that says African American women can be treated in a way that's different, and they can survive. And then that tends to permeate the belief and the culture within the hospital setting, within the clinician-patient relationship. Because in most cases, you will hear, it's fine, I know what I'm doing. But again, not taking into account the children. For me, for example, and I have my children in Pennsylvania, I was connected, for my second child, connected to all of the monitors, and they're saying to me, your baby's only about 6.5 pounds based on this, and you should be able to push her out. Your hips are wide enough to push her out. My baby was actually over 9 pounds.
Oh, my.
And eventually, it was ugly trying to get out. So again, we walk in with these preconceived notions about things. And even though medical professionals understand our bodies are different, we react differently, and it's a bridge. You're actually going, and it can take various turns. There are some biases that just allows folks to just take for granted that the outcome will be what they think it ought to be, as opposed to paying closer attention to making sure it gets there. And also, what we've learned over time talking to women, the doctors are not listening to what they're saying. I've delivered 200 babies. You're just one of them. So I think you're okay. Only to find out, oops, no, sorry, I missed something.
Right.
So again, the move towards actually working with clinicians, and one of the things that we're doing with our Healthy Start program is to do grand rounds across our hospital system and offering it as well to the other Bronx hospitals and medical providers to really look at implicit bias as a concern, to also look at maternity and maternal processes on a more individual basis, and then be more client-centered. We know the move is towards client-centeredness or patient-centeredness.
Right.
And so
So focusing
that
on each
should
mom
be looking at
alone.
each person in that
Independently.
room
Yes.
individually to make sure that whatever is being presented is actually specifically relates to that within the scope of the practice,
Yes.
and then address it in a more normative way so that the outcomes could be better. I mean, clearly we know things can occur that is outside of everyone's control, but are you doing the best that you can for that person directly in front of you as opposed to what you think ought to happen in that case?
We're going to continue the conversation. We have to take a quick break, but I want to come back and continue talking about your individual programs and what you do for the community. Continue to stay tuned for this special edition of Open.
Coming to you from our BronxNet studios, 4 new shows highlighting some of the best of the Bronx has to offer. We sit down with political leaders on In the District and discuss local legislation, events, and issues. See how the community and business come together with The Bronx Now on BronxNet. Nosotros features leaders from a Latino community. Meet those who are moving to make a difference in public service, business, arts, and culture. Looking for new and exciting dining experiences? Then you'll want to savor the Bronx and try new restaurants and eateries that fill the borough with delicious dishes. We have it all, so experience the Bronx in new and fresh ways on BronxNet.
Welcome back. We are continuing our conversation on maternal mortality with Rosie Hernandez, health educator at the Bronx Health Link, Glennis Thomas Perales from Bronx Care Health Systems, formerly known as Bronx Lebanon Hospital, and Alma Idahan from Einstein Hospital. So ladies, we were having this conversation about how important it is to educate mothers on the resources that we have here in the Bronx, and thankfully you all are part of great programs. So I want to focus on that to talk about the resources that you're offering to women here in the Bronx. Why don't we start with you, Alma?
Yeah, so I am the program manager for the Bronx Healthy Start Partnership, and Healthy Start Bronx is one of 5 Healthy Start programs in New York City, and one of 100 across the nation. It is funded by HRSA, and federal government through the Maternal Child Health Bureau. And the overarching goal is to impact and reduce infant and maternal mortality rates. So it is a community-based strategy wherein we are connecting with community partners, such as these folks here and others, to really make sure that women of reproductive age is connected to care and support, whether it's medical or social services that to help them and their families to live really healthy, productive lives.
And one of the things that you do, you go and visit the women in the home after they give birth, right?
So we work with moms, women, again, interconceptionally and through postpartum, and part of the service is to offer a home visit to women, high-risk women. And that means our community health workers will go to the home and talk to the mother about whatever issues or concerns that she has, make sure that she has the services and or understand what services are. So we serve a role similar to a navigator, you may say. So what are the needs that she has and where are the resources, and try to help the mother to connect with those, make appointments, escort on appointments, and then make sure that the mother during pregnancy, postpartum, and the baby are actually doing well and have the services. We're also engaging with fathers because, of course, that's the critical element in this whole process. And in the past, most of the maternal child health programs did not include. And it's still a climb because although we are trying to engage in service fathers, they're not part of our census that we do, but we know that it is important when we think in terms of family resilience. And so we're working with the fathers, we're doing the home visits, we're connecting to services, and then, for example, we're subcontracting with Bronx Health Link, who does health education. So the moms would then be able to get education around breastfeeding, around doula services, and the other things that may become important for them and their children, early intervention programs and support for the families. So we work with the moms with the child up until 2 years old. But if the mom gets pregnant again, and we're hoping a part of our work around birth spacing, so there's a delay for
that's so
better
important.
outcomes,
Yes.
that we won't see that within that time frame. But if that happens, then naturally we begin the process again, making sure the mother is healthy and will have a healthy pregnancy and healthy delivery.
And it's funny that you mentioned birth spacing because
Right, it
when
is
you
very
go back to the older generation, and no offense to older generation, my
Right.
mom has 8 kids, right?
Mine
And
too.
it was 8 of us, right? So it was like back to back to back to back,
Yeah.
right? And now I'm like, how did you do it? Even she says right now, she's like, wait, don't have, like mine, they're 2 years apart. So my spacing
Yes.
was good.
Right.
But she always tells me, wait, because your body has gone through so much. And it needs time to recuperate. You know, the doctors tell us this for a reason.
Right,
You know, and
right.
because I remember sitting after I had my baby, they're like, "So what are going to be your contraceptives?" I'm like, "I just had the baby." Like, but they're asking for a reason. You know, it
Yes.
has to be asked because
Right.
they want to promote that you should really wait a while before you have your next child, and it's not just right, not just for your body physically, but I think
Right.
also emotionally and mentally, it really helps, right? And
It helped the mother and the baby.
and the baby,
Yeah.
right? You know, so that you're able to connect with the child a little while before you have your next child.
Right.
So Rosie, tell us what you do at Bronx Link.
Well, at the Bronx Health Link, I am the health educator, also a birth and postpartum doula. So I came in, introduced to the Bronx Health Link because of that. The Bronx Health Link is a public health organization, and we partner with her program and also Bronx Smiles. And we provide education, advocacy, research. I come in with funding from the Maternal Infant Health Project, which is funded by the Department of Health and Mental Hygiene. And so the education we provide to prenatal, postpartum women is the option of, or consider, formula feeding or breastfeeding. And it's your choice, your decision, but when you decide this, it'll be an informed decision. And also to look to see that you have support. I find that if this were a relay race, the baton for breastfeeding, it kind of fell. And so formula has become the champion. And so the idea
Even
is,
now, I feel like a lot
Yes.
more women are really trying to breastfeed
yes,
because the community for women who are breastfeeding is increasing.
because it's being driven by women that realize, hey, I can feed my baby, I can do this. But when you have socially, when you see, I mean, there's a lot of great positive changes. And so coming to the fact that breast is best because it's a health imperative. Our babies need to fare better. When moms breastfeed their babies, it actually is a gift to the woman's body, emotionally, psychologically, and actually helps her recuperate from the rigors of birth and being pregnant. We also provide family planning and some decisions that moms have to make before they have their baby. We're finding that many women do not go to their 6-week appointment, but they'll take their baby to the pediatrician.
Wow.
And so moms, because when babies are
Putting
born,
herself
the
second.
focus, the
Right.
focus is baby, and putting herself second, and not realizing the impact that that has to her infant.
Right.
Also maternal mental health, kind of coming in and realizing, is this the baby blues or am I depressed? And what to do about it and prepare, and that the family know how to support the new mother, right? So that's what we do. And I'm really excited that I have the privilege to speak specifically to Bronx moms.
Yes.
I love the Bronx. I think I'll always bring a Bronx side. Bronx women, women are resilient. But I think we do them a great disservice when we ignore the fact that they bring life
Yes.
and we should support them. specifically when they're most vulnerable and when they're nurturing their young ones,
Yeah,
right?
definitely, yes.
Everybody has a mom to come to the world. So I think this is May, Mother's Day, right?
Yes,
Mother's coming up. So this is an awesome opportunity
really
to
is.
kind of honor women, support them,
Yes.
and that we're important, right?
Another piece of
absolutely.
the education that happens is also around safe sleep.
Yes.
And we're having an event coming up in May,
Oh,
the
okay.
23rd.
Yeah.
But again, that's a huge, huge concern for us here in the city because we know we are losing at least one baby a week or so.
Right.
And so how do we actually talk to moms about making sure your baby are safe at home? And what are some of the things and whatever resources they may need to help them to move that process
And
forward.
Glennis, I'm sorry, because just before we run out of time, go ahead.
Just, I think people don't realize that adult beds are not made for babies,
Oh, yes. I know, right?
And so that's simple conversation.
Right.
Which we covered a lot.
So Glennis, I know you're also, you educate women pre and post labor as well.
Right. So we engage the women while they're pregnant. This is the main goal for us, to educate them from the first maybe weeks of the pregnancy and walk with them through the pregnancy, educating them through the trimesters. A lot of the times women don't know what they're going to expect in this trimester. Well, but I'm feeling this kind of uncomfortable. Well, you know, that is normal. That is okay. The baby's moving, the baby's kicking. And like I was telling you before, we don't get educated. Our families, our moms don't even tell us about menstruation, right? We learn that later on when we go through all those processes. And the most important thing is providing education to the women. It's giving this program, we all here, right? Our program is similar to Idaho. We are linked with the Bronx Link, I'm sorry. And we're here to provide this education, to tell the mom, you don't have to go through this process alone. Our
Right.
program is a whole business program, so the education comes to the mom, right? A lot of the time, I don't have time to come to your office. I don't have time to do this. Well, with us, we come to your home, we provide the education. At Bronx Healthcare System, we don't only have my program, we have 3 other programs that are family center, education-based, and each of them have different components, right? To the rules mortality, and childcare.
Real quick, because we have to wrap up.
Okay.
Time is running. Quick advice that you give to women to prevent maternal mortality. Real quick.
I would say know your body and advocate for you.
Be healthy before you become pregnant.
True.
Oh, absolutely.
Absolutely that.
Absolutely, yes.
Yes. Yes.
Yes. Well, thank you so much. This has been great. We could go on and on about this conversation, but I'm just so happy that we're starting the conversation here, and we'll definitely continue talking about this. But we thank you for your advocacy. We thank you for your services that you offer to Bronx moms. I thank you as a Bronx mom. So it was really a pleasure having you all here with me today. Thank you very
Likewise.
much.
Thank you.
Thank you for having us.
Thank you. If you or someone you know is looking for support, you can find out more from the information listed on the screen. Thank you for tuning in. I'm Veronica Guiti. Until next time, remember to always let your light shine.